Finance Minister Nirmala Sitharaman, during the interim budget presentation on Thursday, proposed to boost the government's efforts to ramp up vaccination of young girls to prevent cervical cancer. Now, this development follows a month after Health Ministry said that it is closely monitoring the incidence of cervical cancer in the country. Today, in another shocker, social media sensation, Poonam Pandey's team said that the 32-year-old model had also succumbed to cervical cancer. This is also an opportunity to understand what cervical cancer does to you. But how prevalent is this form of cancer? What the numbers say is around 75,000 women in India die each year of cervical cancer. But how important is it to have an extensive HPV vaccination campaign targeting girls in the 9 to 14 age group? And why is this age group so important? What happens to older women? How important is it for them to get a pap smear test? How can one prevent this form of cancer? To understand all of this, we have with us a group of esteemed guests. We have Dr. Archana Dhawan Bajaj, who is a gynec at the Nurture IVF Center and CK Birla Hospital. We also have Dr. Anita Ramesh, who is a senior consultant medical oncologist at the Apollo Hospital. And we also have Dr. Vijay Bansal, who is a director at IVY Hospital and also a surgical oncologist. Thank you all of you for joining me on this broadcast. Let me go across to Dr. Bajaj first. Dr. Bajaj, India has a population of over 500 million women who are aged above the age of 15. So in that case, they are at a high risk of developing cervical cancer. Now, what I understand is that a vaccine has been around for last 17 years. We finally have a made in India vaccine. How safe is the vaccine and how important is it?
My heartfelt condolences to Ms. Pandey's family and the rest of the fraternity for this loss of a very young, beautiful life. And on heels of that, most apt to say that the 9 to 14-year-old window is the window which is the best window to catch for young girls. The vaccine is very safe, and I'm sure the oncologist will back it up. Very, very few side effects, barring some local side effects like irritation or a little lump or a little bit of itching around the site where the vaccine is given. Really, up until now in my clinical practice, I've heard no side effect of the vaccine. And this is a window where most of our young girls now start exploring life, exploring world. And this is also the window where they probably enter into an era where they are getting exposed to the HPV virus. And also this is the window which is the best window to catch because the disease hasn't developed yet. The minute the disease starts developing, the progression becomes difficult to control. So before the exposure actually happens is the right window to vaccinate. And that makes it all the more so important to catch girls in this in this period. Also just something that I would want to add totally off the vaccine and the cervical cancer tangent, that this is also now an opportunity for young girls to interact with a healthcare provider and to discuss sexual health, to discuss menstrual health, because as we are moving into an era of sexual liberation, we also have to understand that our girls' sexual health is very important, and that is something we cannot brush under the carpet.
Right. Dr. Ramesh, cervical cancer is the second leading cause of cancer among women. But incidentally, both breast cancer and cervical cancer are seen as diseases that can be prevented. In that context, tell us what are the risk factors, what are the factors that seem to cause this form of cancer, and also how can we prevent this? Vaccine is of course one thing, but what are the other ways of staying protected from cervical cancer?
Yes, thank you. Just as a coincidence, one incident and one prevention, both came together almost at the same day. Now, quickly coming to, yes, cervical cancer was the commonest cancer in India if you take 2 years back. The thing has changed. Now cervical cancer, second commonest cancer, because India has done well, we are aware, and yes, it picked up early, patients got treated and survival was good. Now, what are the risk factors? Yes, multiple sexual partners. Yes. Then unprotected sex. Sexual contact exposing you to multiple infections, sexually transmitted diseases, out of which one of them is human papillomavirus, the other is HIV, and the other sexual diseases. Next, point number 4 is that multiple childbirth. Remember, if you, our elder generation, our grandmothers, and all had many children, childbirth, 8 children, 9 children. So multiple vaginal deliveries causes trauma. Okay, and then those who are into this sexual profession, they are all gets infected. Apart from this, cigarette smoking is related. So these are a couple of 6-7 high risk factors: unhealthy sexual habits, HIV infection, HPV infection, multiple partners, promiscuous partners, multiple childbirth, early childbirth, all are exposed, and smoking. So there are almost 8 to 10 points which expose you to high risks of the cervical cancers.
Right.
Now, coming to prevention, there is a national program of ICMR which tells you to do pap smear, which starts as early as the age of 25. Okay, and it should be, if it is negative, repeated once in 3 years. If it is positive, do a colposcopy, biopsy, meet the gynecologist to prove that it is not cancerous. Apart from this, sex education, avoid barrier sexual methods, and avoid unknown partners, avoid infection. All this goes into say, because these all precipitate, they change the epithelium of the cervix, and multiple intercourses and multiple traumatizes that and causes mutation in the mucosa of the cervix. So the cervix goes mutated, dysplasia, anaplasia, and the cancer develops. One more thing I want to tell at this context, why the age 9 to 14 has been chosen. Ma'am has nicely described. Beyond that, what I want to put is the age before the sexual contact you have to give the vaccine. Once you are exposed and you had a sexual contact, the efficacy of the vaccination decreases.
Right.
Now, if you see the permission, the vaccine can be given from age of 9 up to the age of 45, provided you did not have a sexual intercourse.
Okay.
So some people can take it at 45, provided you are not married, not had an intercourse. So that's how the vaccine goes. 4 to 19 with the sexual liberation area is the area, give the vaccine and 1 dose and give another dose.
Right.
I have given for many patients.
Right. Thank you, Dr. Ramesh. Let me go across to Dr. Bansal. Dr. Bansal, at present we have the Cervavac, which is the Serum Institute's made in India vaccine against cervical cancer. Now that is available in market for about rupees 2,000 per dose. Do you think it is important to have universal vaccine coverage? And also tell us if this vaccine also protects one from other HPV strains that cause other cancers, say of the vagina or anus or something like the oropharynx.
Yeah, actually this vaccine is compulsory for the girls, but it is useful for the boys also, because HPV is a risk factor for not only for cervical cancer, but it is also for oropharyngeal cancers, then anal cancer, and then genital warts, and then vaginal cancer. So these are few other diseases which are caused by HPV virus. So nowadays we are not having only this 4-valent vaccine. We are also having 9-valent vaccine also available, which is covering other strains of HPV also. So these strains are also a risk factor for other cancer, also for the oral cancer, you can say oropharyngeal cancer, and anal cancer. So these cancers are also important for boys also. So it is mandatory, or I will say it's necessary for the girls.
Right.
But also important, it's also a risk factor for the penile cancer also in the boys.
Right. Dr. Bajaj, let me ask you this. So what happens to older women? And also tell us the importance of a pap smear test and how important it is for women above the age of 15 to have regular pap smear tests.
As Dr. Anita said, pap smear can start as early as 25, and this is perhaps one of the easiest to do tests and rather easy to interpret tests. Cost implications also remain by far not too many. So just screening the cervical secretions for any abnormal cell type puts aside women who are at higher risk of conversion to cancer, or who are at higher risk of getting a likelihood something say in between a normal screen and going on to form a cancer. So really this is one of the very, very few cancers which are completely preventable if screening is adequate. So if a pap smear is done well in time and you do pick up people who are at higher risk of having an abnormal cell type or having a carcinoma in situ or having a CIN or a progression, then you're obviously putting aside people who can have like a loop excision and that the damaged tissue kind of done away.
Right.
And also you're picking up people with early changes of cancer who can eventually be treated. Now, cervical cancer is one of the few cancers, if picked up well in time, can eventually, and I'm sure my oncologist friends will agree with this, can sometimes result in complete cure with no long-term sequelae.
Right. Thank you, Dr. Bajaj.
So,
thank you, Dr. Ramesh, and thank you, Dr. Bansal, for joining us on this broadcast on preventive healthcare, even as the government gets ready to promote and ramping up preventing vaccine campaign against cervical cancer.